Western countries are really good at mobilizing and organizing themselves. And this is the thing that's lacking in third world countries. So I always tell them the best thing they can export to third world countries is this ability to mobilize, because then they can do something for themselves. So we do all these 5 programs in the Swat Valley, and so far we've been very successful. We built 6 of our own schools. 2 we run with an organization called Early Education Foundation, and then 2 it's in Swat and the rest of Pakistan. There are a lot of schools called ghost schools,
Mm-hmm.
and
Yes.
these are schools that were built but were never sanctioned, and they don't have any students in them. So the building is there, but no
Mm-hmm.
students. So what we did with those schools was that we went to the government, organized the community, went to the government, lobbied for teachers and funds to pay for the teachers. And luckily, the government took ownership of those schools, brought in the teachers, and we, SRI, agreed with the government to renovate the schools for them, because they don't get funding for the schools, for building structures. So we did that, and luckily we were able to make 2 schools functional. So we have those schools, and we still support those schools. If they have something, if they have a teacher that the government's not sending, we send a teacher there. If they need a well, so we're still supporting those schools.
So even where the governments failed, where the government infrastructure
Yes,
failed, you
exactly.
swooped in and kind of saved it.
Yeah, exactly. So those are schools we have too. And in the health sector, we cover almost 30,000 people.
Oh,
And
what's the population of Swat at the moment?
I think it's close to maybe 3 million.
Oh, okay.
Yeah. So we've covered with our health program, we covered 30,000 people, and we provide them with healthcare. Women, it's basically a mother-child healthcare program.
Okay.
And it's basically preventive and providing tertiary care for people over there. And the way we do it is we train these lady health workers that we send into homes, and because a lot of people don't have the means to go to hospital.
Right.
So a lot of them don't get vaccinated. A lot of them have their babies at home, and that puts them at risk for death and disease and, having problems later on.
Correct.
So we send the women to their homes. We regularly monitor them. We provide them with information on how to prevent disease, how to look after their children, and what we've done so far, we started in 2010, and till now, we have reduced infant mortality by 65%.
Wow.
Maternal mortality by 98%, and we've increased vaccination rates by 99%.
That's incredible. That's probably better than entire Pakistan.
Yeah. So yes, our figures are higher than what Pakistan is able to achieve. But we have a very much smaller area, of course,
Yeah, but then your resources are very limited as well, right?
Yes, exactly. Yeah. And a lot of people say that the kind of program that we have and the people that we impact, most organization would spend like at least $2-3 million on that. And our budget is 150,000. Because first of all, we are all volunteers, 100% volunteers in the States. We all do this as friends. And because I pay for the overhead and my family, we pay for the overhead of the organization, we are able to send 100% of whatever people give us to
so whatever you generate is just sent to you.
100% is sent over there. Yeah. So this is how we're able to do it. And by organizing the communities also, it creates like literally tens of thousands of volunteers for us. So by doing these things, and we are able to do it. And our promise to our donors is that 100% will be spent on the people. And there's a zero tolerance for corruption in our organization. Plus, I go back for 3 to 4 months of the year
Every year.
make sure that everything is running smoothly. We start new programs at that time, and I make sure that every penny is accounted for.
So your
So
presence is very, very physical. It's there. You're
yeah,
in the
exactly.
thick
So
of
I'm
things.
hands-on, and
Yeah.
the thing that I enjoy about my program is when I go back and I meet the people and I'm roaming around in the villages and I talk to them and I see how grateful that they are. So I think when we help the poor, I think we benefit more than they do because it touches our heart, makes us more peaceful, it helps us elevate our minds, and it makes us lead a more fulfilling life. And the thing is that
If
I
only
think
everybody realized that.
yeah, they don't. That's what I'm saying. People who
Yeah.
don't realize that are not very fortunate because
No.
even though you may have a lot of money, unless you're giving and helping other people, uh, your life is not complete. You know, my life was not complete until I
Yeah.
started
Until you
doing this.
found this.
And just educating someone is such a big thing. I feel that I always tell my friends that if every person in the world who could afford it could educate just one child, we would reduce uh, poverty and by almost 20 or 30% in the world.
So also one of your major focuses in that area is women empowerment. How are you going on about that?
Okay, but for the women, we have these vocational centers where we train them with, the Swat is known for its handicrafts
Right.
and its pulkari or needlework. It's a
Mm-hmm.
very unique kind of needlework which is done from the back. So we are trying to bring that back too, and whatever the woman is interested in, we have several programs that they can
Okay.
join and learn whatever skill they're interested in. And once they learn that skill, we give them tools because most women are not allowed to go outside and have a
Right.
business.
I was going
Most
to
women can only have the business at home.